how many teeth we have to isolate when we apply rubber dam during our restorative procedures. For sure, when we want to restore a tooth, we are very focused on it or in these teeth, and then we have the attitude to have a small isolation of the field during our restorative. When I see some cases in socials or in other kind of situations, I can see that some colleagues are very, very focused on isolate maybe in a posterior tooth, 3 teeth, 4 teeth. This is not sound me very, very good. Considering the teachings that I received from my mentors and considering our experience in our daily protocols that we apply, I think that absolutely we have to extend the isolation of the field in a quite wide way. So considering maybe a first molar, the idea is to isolate the field usually at least at the central incisor of that semi-arch or to the contralateral canine. This is something that I want to tell you a secret. It's for free. And so you don't have to waste a lot of energies in order to put some additional holes and to create this kind of sitting in the anterior teeth of the rubber dam. Because it's much easier considering to adapt the rubber dam in posterior teeth. And the main reasons about this kind of procedure, this kind of attitude, is that you can have a wide extension of the field isolated, and so you can have a better approach, you can have a better handling during the procedure that you have to perform in the tooth, considering that you have this kind of wide area isolated. You can stabilize immediately to the incisors the rubber dam, and so you can concentrate yourself in the posterior area, and then you can stabilize much better. You can have a better stabilization during all the procedures that you will perform, and another reason is that you can check the morphology and you can do a comparison during, for example, direct restorations when you have also maybe the premolars, if you are working on a molar, isolated. When, for example, on the opposite, on the contrary, when you have to isolate the field, just 3 teeth, so molar, molar, and premolar, when you set it on premolar, maybe it's not stable. So the attitude of the rubber dam is to go back and not allow you that you can have a good isolation of the field. So in this case, you have to put an additional clamp, maybe put it on the different direction, in the opposite direction. In this case, you are limiting much more the approachable area or the access to the area that you have to work on. So summarizing, when we are working on a molar or in a posterior tooth, we try, when it's possible, when we don't have on the anterior area splints or other kind of situation that we can also manage, but we are not talking about this in this video. We try to isolate from the second molar to the central or from the second molar to the contralateral. When we are working on anterior teeth, we want to isolate at least from first premolar to first premolar, but if we have to work in multiple teeth in the anterior area, we can go in the second molars or in the first molar as well. Good isolation to all of you. See you in the next video. Ciao, ciao.